We had a child that had traveled 9 hours by road with something stuck in their airway.
My wife calls me in a panic. Daughter has been bent, I don't know what to do.
This was a 3-year-old who had swallowed a coin.
21% bends.
A 7-year-old girl.
Child was less than 6 months.
The beep is going down and it doesn't seem like everyone is concerned about the beep.
He said, no, you can't do that.
I'm here, I have the knowledge, I have the expertise, but I just can't reach everyone.
You could lose the child.
They just arrived in the nick of time.
A lot of people don't understand what we do.
Such moments made me think like maybe there is this gap that we need to fix.
You know, it really shows how much your services and skills are needed.
Thankfully, the child survived.
The child did survive.
We lost the child on table. If we had had a pediatric anesthesiologist, I think maybe the outcome would have been different. Yeah.
In the last 10 years, Nairobi has trained fellows from over 11 countries in Africa, and all of them have gone back to their countries to be the only pediatric anesthesiologists for their country. And that is how we came up with the idea that we need to train more people in the places where they are.
This is our second year of the Pediatric Anesthesia Fellowship for PATA. We have fellows from Zambia, Uganda, Nigeria, as well as Kenya coming through.
My name is Sophie. I'm a Pediatric Anesthesiology Fellow under the Pediatric Anesthesia Training in Africa program.
I'm Ronald Bisegera, a Pediatric Anesthesia Fellow.
Dear Dr. Chalwe Mutesa Mwewa, thank you for your recent application for the PATA Zambia WFSA Fellowship Program. I'm happy to share your application was successful. The WFSA wishes to award you with a fully funded position on the PATA Zambia program. Please respond to this email by Wednesday, 12th July, confirming you would like to accept the fellowship. I did not wait for the 12th of July. I responded immediately.
So I think that in terms of where anesthesia lies on the landscape of Africa, and in particular Zambia, we are definitely on the back foot. Surgical training in Zambia has been happening for almost 4 decades. Anesthesia is only 10 years old that we've been training general anesthesiologists, and we're in our first year of training pediatric anesthesiologists.
So we envisioned developing PATA. We had been speaking about how do we increase the ability to train and to have more leaders in pediatric anesthesia. I think many of us recognized, and I guess were alarmed, looking at the numbers out there.
The World Health Organization estimates that 50% of the surgical population will be under the age of 18 by 2030. That's in about 6 years from now. So half our patients are going to be children, and we need to have a proper approach to treating them.
Then we have a significant pediatric population. We can't treat them like adults. They are not adults. They're a special population. They require special need. Having this training now says, okay, we have to have guidelines. We have to have protocols. And then for the critically ill, this is how to care for them. This is how to look after them.
My expectations is I'm going to learn how to offer safe anesthesia for complex pediatric surgeries. I'm hoping to gain more skills in training others. And then advocacy for better services, because even when you have the skills without the equipment, it's still difficult to offer safe anesthesia.
Not everybody has access to, a simulation lab as well as the equipment, because it really does take a lot of sophisticated equipment that you need to be able to manipulate depending on the scenario you have.
Getting to work in different environments, getting to work with different pediatric anesthesiologists, being taught by renowned pediatric anesthesiologists. PATA really gave us a broader understanding of what it means to care for pediatric patients.
If everything goes as intended, I hope that we will have, in 5 years, at least 10 pediatric anesthesiologists in Uganda. That means better training for just the residents coming out of the universities, better training for the non-physician anesthesia providers who still provide the bulk of anesthetics for patients, especially children in most sub-Saharan countries. And then of course we'll have more pediatric anesthesiologists who will be able to work in the roles of clinician providers. You know, if you have numbers, then it allows people to serve in other roles, right? So sit at the leadership tables and make decisions, get involved in policy making, as well as, you know, engage in more research in the field and help us to use data that comes from our own settings.
I come from the place where anesthesiology as a specialty is young, and because of that, you find that you really need leaders and educators in different specialties for the specialty to actually grow.
Being one of the first people who's qualified under this program means that I'm in the unique position to be able to speak about this program, the benefits of this program, the need of this program.
What I would look forward to is seeing that almost every African country has a training program for this pediatric anesthesia fellowship.
When you've got a happy team, outcomes are better.
It's increasing the safety and correcting mistakes that are being done. I'm very, very hopeful the PATA program is going to improve lives and make lives better.